It used to be filled with numerous health workers, but the once busy Accra Psychiatric Hospital at the time of our visit looks deserted. Many of the health workers here have left to seek better working conditions abroad. If nurses are increasing, as we say in Ghanaian parlance, hotcakes, specialist nurses like the ones who work in psychiatric hospitals, the cherry on top. And the nurses here know it, so there are many who remain here but are constantly on the lookout for the next opportunity. Abigail Alorewe is one of them.
We are working in Ghana, but there are certain things we are not getting. Let's say I'm a nurse, but if I'm struggling with my health, if I need medications I need to buy, if I have to go to the hospital like every other person, if I don't have my health insurance, I'll not be attended to. And Ghana Health Service, I don't know what they are doing to support us. We are not getting that support in terms of our health.
If the World Health Organization has its way, the 30-year-old senior staff nurse at the Accra Psychiatric Hospital will remain in Ghana. World Health Organization has had Ghana on a red list since 2020. Officially called the WHO Health Workforce Support and Safeguards List, it means no active recruitment is permitted from these countries, the organization said. So, the United Kingdom has obliged announcing that it will not actively recruit from Ghana. But nurses like Alorewe are not moved.
We are not giving up because we have lots of opportunities everywhere. I'll go because I'm looking for greener pastures on you.
And for good reason. On the official National Health Service employers website, a statement says the list doesn't prevent individual health, social care personnel from independently applying for employment in the UK. Beaten by life due to her profession as a nurse in Ghana. But that will not stop Margaret Osei, not her real name, from executing her work. She has devoted her life to caring for mentally challenged persons at the Accra Psychiatric Hospital, a job she's passionate about. But she says conditions in the country just don't help, so she's looking for a way out.
I don't feel this country finds it as important as much. Ghana being part of this red list thing, it's making some of us question ourselves from here what's next, because this is a country where after going to school, doing your nursing, you have to wait for years to be able to work in the government sector. So that means from here we are going to sit at home.
What complaints did you take there?
Letitia Blay, 36 years, is the oldest worker here among the ladies. She has been working at the Accra Psychiatric Hospital for 13 years. She has devoted her life for the job, giving counseling to patients. And it's just one of her responsibilities as a senior nursing officer. But she's struggling as a health worker to live.
Not just me, but basically everyone would like to travel outside of this country. For their family, for themselves, at least to get money. I am struggling as a health worker in Ghana because, let's take for instance, the tax that we are that's being deducted from our salaries every month could make up for someone's salary in a month. And for that alone, you would ask yourself, what are you working for?
The United Kingdom has stopped the recruitment of skilled health and social care workers from Ghana and 53 other countries across the world. In its updated code of practice for the international recruitment of health and social care personnel in England, the British government placed 37 other African countries on its red list, which was based on the World Health Organization Workforce Support and Safeguard List 2023. At the Accra Psychiatric Hospital, where I am at the moment, they lost 45 staff, of which 42 were nurses in 2022, and more are still leaving daily. The Deputy Director of Administration at the Accra Psychiatric Hospital, Julius Kusalusuo, is worried the continual poor working environment means decisions like the one the UK made will have no impact on retention of staff if conditions don't improve.
For 2022 alone, if you add leave of absence to vacation of post or resignation, 55 nurses left the hospital. This has had a very serious impact on the hospital. Because number one, it is the most experienced people who are leaving. The sad thing is that for psychiatry, we don't have them so much in the country. It is actually struggling, I must admit. Because besides the conditions of service I'm talking about, logistics to work with is a problem. As I speak, almost all the suppliers have run away from the hospital. They don't want to do business with us because we owe them.
Ghana's Registered Nurses and Midwives Association says more than 3,000 nurses and midwives have left the country to seek better opportunities in the UK, Canada and the US since the beginning of the year 2022, including doctors. This poses a serious threat.
I have said it copiously that the salaries of nurses and midwives in Ghana is nothing to write home about. There is no condition of service in terms of food allowances or accommodation allowance, rent allowance, or anything. Anything that went for nurses and midwives years back had been removed.
It seems for Ghana's nurses, the path to a fulfilling life lies on flight to the most advanced countries. Godwin Asediba, TV3 News, Accra.